Thank you all for being here this morning. Joining me is Dr. Mark Moss, Head of Division of Pulmonary Services and Critical Care Medicine at the University of Colorado School of Medicine. He'll be able to share a bit about what they're actually seeing clinically from people of all ages that are in need of immediate medical attention to save their lives. He'll also be able to talk about some of the challenges that are being faced by the medical community across our state. First, an update. On the federal side, Saturday night I was called that we've successfully secured a Colorado major disaster declaration from the federal government for our state of Colorado that unlocks access to additional resources. We were able to announce that Saturday night. I want to thank the President for granting that request and most members of our congressional delegation who supported that request, which really underscores the seriousness of the challenge that we face in the days and the weeks and indeed the months ahead. Now, in a practical sense, this declaration is a prerequisite to greater emergency assistance, but it's also an important recognition of what's already occurred and the lives that are already lost and those who are transformed forever. This also helps make sure that Colorado can compete on a level playing field with states like New York and Washington when it comes to emergency assistance. For instance, it helps make sure that the National Guard is placed in Title 32 status, which means the federal government is paying for their activities. Just this morning, I spoke to the President and the Vice President about the need for this being placed in the Title 32 status, as well as the need for the ventilators in Colorado, 9,000 to 10,000 more. We discussed some of the parameters around the timing for those as well. This status also ensures the federal government will help pay for more of the costs associated with this disaster, everything from transportation to care to food and water and essential items at distribution points. This designation, combined by the very robust package that Congress passed and the President signed, is really critical relief for our already overtaxed emergency management. We're looking forward to further increasing that capacity in the days and months ahead. I also expressed to the President our gratitude for the important work of the Colorado National Guard and the Army Corps of Engineers already on the ground here in Colorado. The Army Corps of Engineers helping with additional bed and hospital construction. The Colorado National Guard has supported over 10 drive-through testing sites across our state. And I just want to express our profound gratitude to the people of Colorado, just as I did to the President of the United States, for the critical help of the Colorado National Guard and the Army Corps of Engineers in this critical time. I want to have a few slides that I wanted to go over with you here today. But before we do that, I just wanted to talk about how this crisis will be with us for days and weeks and indeed months ahead. And it's important to pace ourselves in this. Just as we are, and the people here at the Emergency Operations Center, just as you are, we need to get through this in a sustainable way, which means finding new ways to relate socially through online chats and video chats, telephone, reaching out to people in new and other ways. Just because we're physically distant doesn't mean that we need to be emotionally distant. In fact, this is a time when we need to be more together than ever before as we face this crisis. It's just one in which we can't be physically together. As 1 Corinthians chapter 13 says, 3 things will last forever: faith, hope, and love. And the greatest of these is love. And of course, that means faith in the broadest sense. It means faith in science and data. It means faith in your religious tradition. It means hold the faith in the important institutions that keep us together. It means hope. And of course, there's a light at the end of this tunnel, and for the vast majority of us, most of us, we will get through this as a state, as a nation, and as a world. The day will come again when we can get together, enjoy, and celebrate. That day will occur as soon as we're able to, of course. And in the meantime, the greatest of all these, love. That means love one another, love yourself, and make sure that we're reaching out and connecting more than ever before, emotionally with others through different technologies that allow you to do it without being in physical proximity. The President just the other day said that the social distancing guidelines are likely to be in place by April 30th. We know that it could be that date, it could be sooner, it could be later, but however long they need to last to save lives and prevent a longer-term disruption to our economy and to jobs. We need to make sure that we're all handling this ourselves in a way that allows for that sustainability, a way that allows us to reach out to our friends, to our family members, have those meaningful conversations and connect. My son and daughter were video chatting with grandmas, I'm sure many are. And during this time period, even if you're fortunate to have your grandparents and aunts and uncles living in a nearby vicinity, it's important that we particularly protect those who are most vulnerable. And since symptoms seldom manifest, and if they do, they're usually minor in our youngest Coloradans, we want to make sure that they're, to the extent they're interacting with their grandparents, aunts, and uncles, that they're doing so virtually in a way that can even bring people closer than they were before. Now I want to update you with some slides that we have. This is the age graph, and Dr. Moss will also talk about how this is affecting people of all ages. Originally, while the higher percentage of older Coloradans are forced to hospitalization and can lose their lives, there are people in their 30s and 40s and 50s who are otherwise healthy in their prime that are forced into hospitalization, might need ventilators, and can even lose their life. I also have the partial update figures for today that show the continued growth of the virus in Colorado. As you know, we post our daily update figures at 4 o'clock each day at covid19.colorado.gov. Those will be posted today at 4, but I have a partial update now that we have 2,627 cases, 414 hospitalizations, 47 counties, 51 deaths, and 15,364 tests that have been completed. Tragically, in this last day, we also had our first death of somebody under 40 years old, again showing the severity of this virus for people of all ages. Now, that's one side of the coin, the severity, but it's also important to tell you that about 80% or more, 80-85% of folks who contract this virus do not require hospitalization, do not require intensive treatment, and will self-resolve. And if you do have symptoms of the virus, it's important that you completely self-isolate until at least several days after the symptoms have subsided. No fever, no symptoms, several days after. And that will cover 80-85% of the cases. So if you do have flu-like symptoms, COVID-19-like symptoms, don't panic. If you need medical attention, don't hesitate to get it. But if you're able to breathe and if you have a fever, experiencing coughing, if you don't need immediate medical attention, you need to stay in your home and self-isolate until several days after those symptoms have completely resolved. And of course, all Coloradans need to stay at home except when absolutely necessary. And we're going to talk about in these slides some of the success we've seen to date, but also the challenge we have to do even better with regard to having greater physical proximity from one another. Next slide. This is the results of where we are in supplies. This is approximately a 3-week time frame. We feel that after 3 weeks or so, 2 to 4 weeks, the larger scale industrial production will kick in. But we, as you know, have very urgent short-term needs. We're making progress on those. We need, and we express these, I also expressed this to the President today with regard to the ventilators. You can see that we had needed 654,095 masks. That leaves a deficit of about 200,000 in the next few weeks for what we've already delivered out to our care providers. A deficit of surgical masks, and we hope to make additional progress in that in the coming days. We have many irons in the fire. We have a wonderful team. We pulled in top-notch people from the private sector, Sarah Thunberg, Casey Wolf, Matt Blomberg, from other offices in the government. We've set up our innovation response team. They are working to creatively acquire these personal protection equipment in a really challenging global time frame when everybody's trying to buy them. So we have to be extremely effective. Many people have provided introductions, validations for purchasing orders that have been placed. We're hoping to acquire as many of these as we can here in Colorado. And frankly, we'd rather acquire too much than too little, right? We're going to use all the surgical masks and gowns and gloves that we acquire. We'd rather have as many as we can so that that surplus can last us longer as the global pandemic worsens, but also we hope there's enough for many of our other frontline responders, first responders, grocery care workers, and others. We hope that we have additional personal protection equipment besides those that just strictly needed in the clinical capacity drugs and first priority. You also see the deficits regarding face shields, gowns, gloves, and coveralls. We have an excellent team that is working on trying to bridge this gap every day, and we'll continue to keep the public updated about where we are with regard to these gaps. Now, I've been beating the drum for weeks, but we need additional personal protection equipment. We had very successful personal protection equipment drives, and we need people and practices to turn in extra equipment. This is the reason, for those of you who might be frustrated that you had to have your elective surgery delayed, this is the reason we needed it in the short term. All the masks and gloves and gowns that would have been used in that elective procedure, we need them for the clinical setting for the COVID-19 patients in the hospital. So once that supply chain gears up, we hope that there will be a point in the future where those elective procedures, which again for people, you know you need to have them, and I know it's a sacrifice that you're giving them up for several weeks. So we hope that we can address that equipment gap and those to resume. I want to thank Home Depot for donating 5,000 boxes of gloves. We deeply appreciate that. We appreciate all the donations from our private sector partners and others. And I articulated these needs to the President and Vice President this morning on the phone. Next slide. This is the time frame which when we talk about chasing the ghost, and we'll show you what this means. Why? What we're going to be tracking today, we're going to get kind of how the spread of the virus is tracking and how traffic in our state is tracking using several indicators that we look at. But this is why there's a lag impact from when somebody was first exposed, 4 to 5 days of symptoms. There are even cases of it being longer. 4 to 5 days seems to be about the average, but that doesn't mean some don't have a longer incubation period. 79 days is not unheard of. Time to report date, onset to ICU, and onset to death. Next slide, please. So this is the important thing that we all will be looking for in terms of when these impacts hit. So what we are likely seeing now is the impact of the closure of bars and restaurants. That has just rolled on in the last day or two, meaning social distancing that we gained, that we want, the delay in the spread that we want, and we'll get into what that looks like from the closure of the schools and the closure of the bars and restaurants is just going to be showing up in the data yesterday, today, tomorrow. That's what we're seeing. We won't see the impact from the 50% workforce reduction or the stay-in-place order for a whole nother week. And those are going to be very important things for us to track in real time. But that's why this compliance is so important. The more that we can stay at home, the more unnecessary times out that you can avoid, the more effective these measures will be, and the sooner that we can return to being able to support ourselves and earn a paycheck and more economic normalcy. Now, in setting expectations, we know that that new world is not going to look exactly as the old world. Of course, we're going to have to take additional precautions as people go back to work and as they are able to earn a paycheck as soon as we possibly can. There'll be more details on that when the time is right, and whether that date is April 11th or April 30th. Whatever that date is, that we can resume more normal functions of being able to support ourselves. We'll also have additional ways that people can protect themselves in that environment. But it all depends on the effectiveness of how these measures are taking in squashing the spread of the virus. And these are the key dates that you can look at, keeping in mind that, yes, you might see some impact a day or two before the observed impact date, and you might not see the full impact until 3, 4, 5, 6 days after the observed impact date. But we do feel that you'll see a demonstrable impact from these measures on the observed impact date that we indicate here. And so what we're going to be showing you today is likely the impact of school closures, the prohibitions of gatherings of 10 or more, and the closures of the bars and restaurants. Next slide. Now, this is a hopeful slide, and again, there's good news and there's bad news and everything, but what it's showing is that the time to doubling, this is why this is such a scary virus. This was doubling every 2 days in our state, even less. I think there's a point where it's doubling every 1.5 days, the number of patients. That goes incredibly quickly, if you think about it. It's an exponential growth factor. We now, and this is just 1 day's of data, and I want everybody to realize that we want to see where this number is over tomorrow, the next day. But at least now, as the effects roll on from the bar and restaurant closing, it looks like the average doubling time is approaching 5 days. So first the good news, that's a lot better than doubling every 2 days. Now the second piece of that news is that it's still an extremely contagious virus, which shows why just closing the bars and restaurants wasn't enough. If you have 1,000 people in 5 days, it's 2,000 people. In 10 days, it's 4,000, and then 15,000, 30,000, 35. It still would spread and have an enormous peak, doubling every 5 days. That's very rapid. So it buys us a little time. Doubling every 5 days is better than doubling every 2 days. But we really have to drive that further, and that's what we're hoping to see with these additional steps as their impact rolls on in about a week. We do hope this number, which we'll be watching in the next few days, will help further reduce that spread. But we have successfully slightly delayed the peak and slowed the spread with the steps that we're taking in bars and restaurants. And as these additional measures roll on, we really hope that this has a bigger effect. Now, a couple caveats. Of course, this is only based on positive tests that we've gotten back. We've ramped up testing, but we know that there's plenty of people who've been infected and haven't been tested for it. So another lagging indicator, a ghost that we're going to be chasing and reporting on, will be the number of hospitalizations. So that will lag several days behind this, but we're also going to show you how that is impacted as a trend. The hospitalization number is not necessarily significantly impacted yet by the bar and restaurant closures. That is rolling on now in the next few days. Remember, time to detection, 8 days. The average time to hospitalization greater. So we're looking at all these lagging indicators to see the impact of what we did a week ago, 10 days ago. And it's why we want to make sure at any given point in time that we're doing enough, that we're taking the bold actions necessary to prevent our state from having an outright public health crisis as is occurring in other parts of the world. Next slide. So this is more real-time data, which will show what we hope will project onto the healthcare data after the incubation period and identification period is over. But we can see that all road traffic on both interstates, U.S. highways, and others shows a significant decrease since the closure order. That's some encouraging news. Now, traffic isn't a perfect proxy because it alone doesn't say whether people are just going somewhere and walking around safely or they're going somewhere and socializing with others, but it certainly is a good proxy. And for all of us, we need to heed this advice. Don't get in your car and go somewhere unless you absolutely need to, right? We want to stay at home to the extent possible. That's why it's called staying home. Doesn't mean you can't, walk your dog around your neighborhood as long as you're maintaining social distancing while you're doing so. But please do your best to stay at home. We are showing a 60% reduction of cars on the road from the baseline 4 weeks ago. Now, we hope that that means more than 60% social distancing, because 60% alone is not enough. We really need to be in that 70 to 80% range. But it is a positive indicator. Colorado Department of Transportation is providing this critical analysis, and this is being reported back to me, to our decision makers, to our state epidemiologists. We're getting hourly, daily, and weekly, hour over hour, week over week, day over day reports to see exactly what impact these measures are having. Traffic is a proxy for changes in behavior, and that can be the weekday work commuting or changes in the weekend that are associated with errands or with recreation. And during this time, we need to do our best to cut down the extent that we can. Please continue. Next slide. When we zoom from 12 weeks to 4 weeks, we see an even clearer picture of the reduction in traffic. That shows daily total car volume in yellow and a trend line for the percent changes from 4 weeks ago in blue. It shows the car volume here, just as before, it's just a different visualization, is down 60% in the last few days compared to a normal run of the 4 weeks prior. So that's a good, healthy decrease, although we know we have a ways to go. Next, please. We can also break this down by highway, individual segments. This shows a summary of changes in interstate vehicle counts by interstate. Also very important, decreasing by 400 cars every day. And we expect and we need that decline to continue. Please stay at home. It's absolutely necessary. The more people stay at home, the sooner we can squash this virus and people can return to work and support themselves. And that's the key message. It's a matter of individual responsibility, yes, to save lives, and that life could be yours or the lives of a loved one, but also the better compliance we have, the sooner that we can move to economic normalcy. Next slide. This is one that we want to talk about because it's so important. You can see the dramatic impact that these measures have had on the Eisenhower Tunnel, the main gateway from Denver Metro to Mountain communities. This is so important that people are not treating this like a vacation, and that people are staying at home. This is not a vacation. This is a very serious challenge for Colorado, perhaps the most serious of a generation, certainly the greatest public health crisis since the Spanish flu of 1918. But this is the key area that we're showing success in reducing that traffic right now, because you know what? Mountains, our trails, our beautiful rivers, they're going to be there. They're going to be there for millennia. They're going to be there long after you're there. So let's take a few weeks and not visit some of these areas and just recreate in our neighborhoods to the extent you need to. Again, walking your dog, you can be active without having to be out, without having to drive anywhere. And that's going to be very, very important. And so clearly don't go into these hot area counties that have some of the highest rates in the state and country. Eagle County, Summit, Pickens, they have very high rates of the virus and transmission. The Eagle County has some of the highest rates in the country. So that's the last place that any of us should want to go. The residents of those counties, they're showing strong stick-to-itiveness. Fortunately, their hospitals are built for tourist capacity. The tourists are gone, so there's extra capacity there for locals. We're so grateful for that fact that even though we have an enormous number of cases in those areas, so far the hospitals have been able to keep up, because those hospitals are built for the surge in population in hot tourism times, and those people are not there. We're just down to our local resident population. And so for now, at least, those are able to keep up. Keep in mind, they are also sending patients down the hill to the Denver metro area, simply because for respiratory issues, often one of the first line responses is get to lower altitude, and that's a very normal thing, and that is happening. But because of the extra capacity that's built around tourism, those hospitals are not in any crisis. Next slide, please. We are all in this together. All together, right? Showing love for one another, respect for one another. I'm heartened by all the positive acts and giving that people have given, whether it's the over $7.5 million that's been donated by individuals at healthcoloradonow.org, the thousands of people who signed up to volunteer, some of which are already being deployed in our communities. The acts of kindness that we know about, that have been covered by news and others, and the countless acts of kindness that aren't even being talked about. The fact that you are calling your 76-year-old neighbor and offering to pick up her groceries and delivering them to her doorstep. The fact that you and other families, some people are putting bears in their windows so passersby can see those. Some are putting up their Christmas lights to keep their family busy with an activity and to light up their neighborhood. I know you're doing all sorts of things in this challenging time. And I know that it's a sacrifice. It's a sacrifice for you, of course, going without the things that are an important part of our Colorado way of life. And it's an economic sacrifice for those who are living paycheck to paycheck and don't know how much longer they can go on without earning that paycheck. We want to thank the federal government for the fact that Coloradans will be getting $1,200 per person, $500 per child soon. Student loan interest payments have been suspended for many months. We've acted in states to delay the need to file your federal income taxes. We also offer to match local jurisdictions that choose to delay their use for sales tax. We will also delay the state component of that. What remains to be seen, and what we're trying to do, is significantly slow the rise and the spread of coronavirus in Colorado. And these initial measures, the bar and club closure, is already showing its impact. We fully expect that these additional separation measures, as long as people are following them, will also show reduced spread of the virus in Colorado and help us all return to be able to support ourselves and lessen the need for more extensive measures over a great period of time. I want to ensure that you get to hear some of the same stories that I hear firsthand about the situation from someone on the ground really as a frontline response to this virus. Dr. Mark Moss is the head of pulmonology at UC Anschutz and a doctor at UC Health. Dr. Moss stepped away just today from his important duties to attend this press conference to help share with you really what's going on from a clinical perspective, what he's seeing with his patients. He's representing, of course, tens of thousands of Coloradans in the medical field who can't be here now because they're risking their lives to save the lives of our friends, neighbors, grandparents, and ourselves. I want to thank all of our medical workers, from those who clean our hospitals, to the nurses, to the paramedics, to the doctors. Dr. Moss will hopefully help give an articulation of some of what you all are seeing. But I know that of all the Coloradans who are making the sacrifice, those who are making the sacrifice, yes, we find it difficult to be at home all day and not go out, but we know that our medical workers putting themselves at risk of exposure every day, working double shifts. You are really in the front lines of making the sacrifice to save lives. With that, I would like to turn it over to Dr. Moss. Dr. Moss.
Governor Polis, thanks for the invitation to speak with you today. I'm the head of the Division of Pulmonary Sciences and Critical Care Medicine at the University of Colorado School of Medicine. I mostly work in the intensive care unit at the University of Colorado Hospital, caring for critically ill patients. As a pulmonary or lung specialist, I've been on the front lines of the response to the COVID-19 pandemic, a respiratory illness that injures the lungs and causes a severe viral pneumonia, or something called the acute respiratory distress syndrome, or ARDS. Due to the COVID pandemic, we are now caring for an unprecedented number of critically ill patients. We've had to mobilize extra teams of doctors and other healthcare professionals, and now have twice as many critical care doctors working continuously throughout the day and night to effectively care for these very sick patients. As of this morning, we have 72 COVID positive patients in the University of Colorado Hospital, of whom 37 are critically ill in the intensive care unit, and 33 of the 37, or almost 90%, are on mechanical ventilation, which is a form of a life support system. This represents more than doubling of the normal number of patients we care for in our medical intensive care unit service, and we're only at the beginning of this crisis. It's important for the Colorado community to understand that coronavirus does not target only older Coloradans and those with underlying medical conditions. Though older people and those with underlying medical problems have a worse outcome if they contract the virus, the COVID patients we are treating are on average in the 40s and 50s, and some are as young as 19 years old. Many of these patients were healthy with no other pre-existing medical problems. So I want to emphasize that healthy people can be infected with this coronavirus and become critically ill. This pandemic can affect anyone. I also want you to understand that once hospitalized, we're observing that COVID patients can go from requiring a bit of extra oxygen to needing to be put on a ventilator or a life support system within a few hours. However, it takes a much longer time for them to get better. The critically ill COVID patients that we are now treating are at the beginning of a very long road to recovery. In general, those who are fortunate to survive will, on average, remain on the ventilator for 2 weeks. Sometimes it can take even longer. New COVID patients are being admitted to the hospital at a faster rate than patients are recovering. And as a result, the hospital census is steadily increasing, putting even more strain on our capacity and our resources. All across the state, our frontline providers are working in a difficult and scary environment and literally putting their lives on the line for their patients. We're learning from the experiences of other countries about how contagious this virus can be. In Italy, more than 50 doctors have died from COVID-19 that was contracted from caring for other COVID-19 patients. In Colorado, we are unfortunately starting to see healthcare professionals test positive for the coronavirus. This is not only devastating to these medical professionals and their families, it hampers our entire response because it sidelines critical medical staff at a time when we need them the most. One example is my colleague, Dr. Catherine M. She's an excellent critical care physician. A few weeks ago, while caring for patients in the intensive care unit during the very beginning of this pandemic, she started to feel sick. High fevers, chills, sore throat, cough, and shortness of breath. She quarantined herself and eventually tested positive for the coronavirus. She's now fully recovered from COVID-19, is not contagious anymore, and keeps asking me when she can go back to work. She'll start taking care of patients again next week. I've never been prouder of all my colleagues and the amazing hospital employees that we work with on a daily basis. We'd be honored to witness their extraordinary efforts to care for our sickest patients. They're working long hours in difficult conditions, putting on and taking off personal protective equipment, while trying not to get sick themselves. Why do we take these personal risks? It's because it's a privilege and an honor to care for patients. However, I do worry about the mental stress that the COVID-19 pandemic is causing on our critical care providers. Working in conjunction with hospital leaders and our state and local public health departments, our healthcare professionals here in Colorado have created a forward-thinking plan to address the coming surge of patients. Due to intense preparation, we're able to stay ahead of the curve. I'm grateful that we're seeing improvements in important rate-limiting steps, such as diagnostic testing. The time to get test results is shortened from several days to less than 24 hours. This allows us to conserve personal protective equipment by only using it for patients that are truly positive for the coronavirus. But in order to be successful and increase the number of lives that we can save, we need two things. We need more equipment, and we need Colorado to take the pandemic very seriously. First, due to the intense preparation at the University of Colorado Hospital, we currently have enough personal protective equipment to care for these highly infectious patients. However, as the coronavirus continues to spread, we will need more personal protective equipment, including masks, gloves, gowns, face shields. We cannot care for our patients if we're not healthy ourselves. As healthcare professionals, we made a moral commitment to properly care for any patient in need. Last night I had a conference call with national critical care leaders to begin the discussion about how to make proper ethical decisions regarding the rationing of resources of things like ICU beds and ventilators. No one wants this pandemic to get to the stage where we do not have enough ventilators for each patient who needs one. Right now we have enough ventilators in the University of Colorado health system. However, we need to stay ahead of the surge and properly prepare for possible shortages of supplies now. In order to honor that commitment to our patients, we need an adequate supply of ventilators, medical equipment, and medications. So what can we do as a community? The most important thing you can do is decrease the spread of this virus is to stay home. And if you must go out, as the governor said, maintain social distancing and wash your hands frequently. We all need to limit our interactions as much as possible to slow down the spread of the virus. Our healthcare professionals, my colleagues, are working as hard as they can under stressful conditions to save the lives of your friends, your neighbors, your family members, and even maybe you. We cannot risk overwhelming our healthcare system. These social measures might seem onerous, but they're absolutely necessary for the time being. Before I close, let me read a text message I received this morning from a dear friend who lives in Colorado but flew back to New York last week because her mom became ill. Mark, thank you for all your kindness. Within a 12-hour span, I lost my dad and my mom. This has been a science fiction horror film. More when we meet again. Please be safe. The COVID-19 epidemic is real, and it's scary. We've never witnessed anything like this before in our lifetime. And on behalf of all the doctors, nurses, and other healthcare professionals, I want to let you know that we are and will remain relentless in our dedication to provide the best care to our patients. It's what we do.
Thank you, Dr. Moss, for sharing that powerful story with you. Really about faith in science, faith in the Almighty, faith in our public institutions, and the hard work of our medical professionals. It's about hope. We will get through this together. Most of us are going to be just fine, although most of us won't be any strangers to loss. And of course, love. Showing love now. It's exciting to see the fact that people have adopted more pets in many of our humane societies and fully adopted apps. It's exciting to see that people are offering to deliver groceries to their neighbors. It's exciting to see that people are doing everything they can to show love. Love for one another, of course, those dearest to you, our families. We should do your best in the difficult circumstances to really cherish this time together with your families and spread that love to your greater extended family, to your friends, those you haven't connected with for many months or many years. We can get through this together, and the hope will be all the brighter, the more love that we can show one another during this crisis. Thank you for joining us, and take some questions.
The recording has started.
Yes.
Q&A session has started.
We'll do in person for Stefan, and then we'll alternate.
Governor, if I